have seen the tears you've cried, every lonely, sleepless night. Nothing hidden has escaped me. I've been with you through the fight. When their words became your burden, when your heart was wearing thin, I was holding every moment, though you could not feel my hand. Come and lay your fears before me. You don't have to bear them now. Be still, my child, and know that I am God. When the world around you trembles, I remain the solid rock. I will fight for you. Be still. Rest within my perfect will. Bring every burden to my hands. I'll sustain you where you stand. No weapon formed against you shall prevail. My promises endure. My love will never fail. Be still, my child. I'm right here. I have heard each false accusation, every rumor, every lie. I have seen the hearts that wounded you. Nothing ever passed my eyes. And they reached against your family when they touched the work you've done. They were never beyond my notice. I've been watching everyone. You are not the names they've called you. You are not the shame they speak. You are mine, and nothing ever can remove my love or peace. Do not answer hate with hatred. Let my peace become your strength. Be still, my child, and know that I am God. Though the mountains shake before you, my foundation will not move. I will fight for you. You don't have to prove a thing. Place every burden in my hands. I'll uphold you as you stand. No weapon formed against you shall prevail. My truth will stand forever when every voice has failed. Be still, my child. Trust in me.
Leave tomorrow in my key.
Leave revenge within my hands. Justice has always belonged to me. I fulfill what I have planned. Do not measure life by voices. Do not count your worth by men. I have called you by your true name, and I call you mine again. What was broken I can heal. What was stolen I restore. I can bring new life from ashes like you've never known before.
Fight for
What I have got, be still,
my child.
and know that I am God.
I am greater
Than the darkness, I'm stronger than the storm. I will fight for you, be still.
You are safe for you, my will.
Bring every burden to my
Never
head.
let you
No
fall.
weapon formed against you shall prevail.
No kingdoms rise and kingdoms
No
fall.
kingdoms rise and kingdoms fall. My faithfulness remains. Be still and know I am God.
Hold on. Can you hear me? Hello, hello, hello. Hopefully. I just have to open my door here. Wow, there is a cold breeze coming in. Jimmy.
What?
It is so cold coming in this door right now.
Yeah,
It's great. It's like
It's in the 50s.
it's colder than air conditioning. It's in the 50s.
Yeah.
In the 50s.
It's 59 right now.
That's crazy. Okay. All right. Okay. Hold on. So, yeah. So, needless to say, is it going to stay cold in August now?
Huh?
Is it going to stay cold now in August?
It's going to be in the 30s next week. No, I'm joking. It's going to be fine, right?
Because it happened last year, and then I didn't get to go swimming again. It's horrible. Okay, sorry, my hair is all like flipping out. Let me check and make sure you can hear me. The kids heard that weird noise again. That's why I am trying to see if I hear it. And then when Ethan got home, he screamed, and then the thing got like scared, and we haven't heard it, but they heard it so close. So we're trying. I want to see if it happens while we're on. Okay, let me see if you can hear. If I can hear you. Oh my gosh, if you can hear me. It's good. I didn't get to go swimming again. Okay. Hello, Debbie. Hello, Ivy, and the rest of the people that are in the bushes. So today, yeah, Debbie, I said we were watching the Clancy trial. Did you get my message? We were watching it in Zoom. So anyway, today we had doctors on. We had the doctor that took care of the doctors that took care of Callan, and they outlined everything about Callan, how he presented, and his pupils were fixed and dilated, and that's not good, and he was not responsive to any kind of stimuli. First they tried the little bottom of their feet, then they tried to pinch him a little bit. They didn't have any reaction to that. And long story short, they found out there was no brain activity, spoke to Patrick, gave the family time to, spend some time with him because they can run the ventilator because his heart was beating. And then he passed away on January 27th. So they had the testimony about that. There was some more testimony from first responders and people, the police that executed the search warrants. So talking about the journals that were found, and again, the why they didn't look in the drawer for the Apple Watch and why the defense attorney found it. He was hammering on that. Then we also heard from doctors and nurses that were treating Lindsay Clancy. And at one point, got like kind of aggressive with the defense attorney and one of the doctors or something, one of the nurses he was hammering. But he just kept saying, he kept trying to push that PPD, like, well, it was PPD. We don't know. They were concerned about PPD or something, so he just kept pushing that. Now, multiple medical professionals have described Lindsay Clancy's cuts as superficial. So we have that. Multiple have said that. She did code, okay. She had a DNR, so if the DNR was after she coded, that's why they brought her back. They did say that she wanted to change her healthcare proxy to her parents. They said, was there anything that was said to you about, and this is again with the medical staff, about why she wanted to change to her parents? And they said, well, no. She just said her parents are really supportive and all of that. And then, hello, B lady. And then she said, she said, do I have a lawyer? So the prosecution and defense tried to go back and forth with that one, Defense said the prosecution's been trying to bring that round. They're talking about how she was restrained in the bed, and at one point she was awake while being intubated, which can cause a lot of anxiety, one of the doctors said. And just that she had a DNR. She did not want to be resuscitated. And then they went over her injuries, and that she had no head trauma. They talked about the injuries to her vertebrae and things like that, and the paralysis. She asked the doctor, is my body broken? They said that she was having hallucinations, but yet the prosecution pointed out that even when she said that was happening, that was when she was changing the healthcare proxy, and they said, did anything change the next day? No, she still wanted that healthcare proxy changed. Yes. So that I'm doing all this from memory now. I'll go back into the notes just to. So her journals. When I was listening to her journals, I think she had thoughts that a lot of mothers probably have. Okay. Is your child meeting the milestones? Are you doing right by your child? She was doing this sleep training. She let Callan cry for an hour and a half, and Patrick was there because she says in the journal she told Patrick she felt like, I think it was killing herself because she couldn't listen to him cry. I don't know why she let him go for an hour and a half. I know, yes, you can put your baby in there, and usually if it's like a couple of minutes and then they'll fall asleep. If it's not, then you go get that. That's my hour and a half. But yeah, okay. She was doing this sleep training, and she was writing all these thoughts about, I shouldn't have started it. He was overtired, and then about that she wasn't bonding with her kids and things like that. Maybe, there's a lot of, that in and of itself, that journal, there's probably a lot of new mothers that have journals like that or thoughts like that. Even like we were hearing last night, people have said, they've had intrusive thoughts. They never acted on them, but it's not uncommon. That's not, I think, if anything, that kind of even goes against what they're trying to say, because she's probably like a lot of mothers having those thoughts. And we're going to go through the court of public opinion in a little bit just to show you. But those of us that are mothers, I'm sure we can identify with some of her thoughts, right? Some of her thoughts. Are we doing okay? If you had to stop breastfeeding because of something, she was second guessing stopping the breastfeeding because she had to take, I guess, the medication. And so for her mental health, but she didn't really end up taking the medication. She stopped the breastfeeding, and he wasn't doing well on the formula. And yeah, there's probably a lot of mothers that have those thoughts. So that in and of itself isn't that bad. She questioned about her relationship with Patrick. They didn't have intimacy between them because she had to get on birth control, and she had some other issues, and she felt bad, and she wanted to, she said, get back to feeling about Patrick the way she used to. So she was having issues there, which again, I'm sure is not uncommon for a lot of women, right? After having a baby. And just feeling overwhelmed. Now, she was feeling overwhelmed. She did have help, right? Her mom was coming at some point. I don't know what is the point that her mom started coming. It might have been after the hospitalizations. I don't know, because her mother was there that weekend before. But they did have babysitters, and the kids did go to preschool Monday. Wednesday, Thursday, I think it was. And then a half day on Tuesday. It was almost every day for some point. So, you know, hi, Kubi. Okay, let's see what you guys are saying. Let me see. I've got to make this a little bigger because I can't see. Because my eyes are not good anymore. Okay, let's see. All right. Now I can see. I did. It's been a terrible day at Debbie's nursing. Oh, I'm sorry to hear that. It's been a terrible day for you. I heard her attorney he's 75. He's 75, Ivy, because I looked it up. Because Linda and I were talking about it, and I looked it up. He's 75, and he looks like Ed Asner. Doesn't he look like Ed Asner? Do you know who Ed Asner is, Ivy? I wondered about a few things she had to do. She had a do not resuscitate. Yeah. Yes. I think they did a fusion somewhere in her back, so I doubt anything can be changed. Okay. I have not heard about her journals. Were they using those? Yes, they were part of today's testimony. An hour and a half. Yeah, an hour and a half. She let it, yeah. That's a long time. That is a long time. Okay, I have a picture of one of her postings in a mommy group. I'm sure I already have it, B-Lady, but she said she was the most uncontrolled baby she ever had. She said he was the most... Yeah, I mean, there were things she was writing, but, I mean, that in and of itself, it's not that she just wanted to kill her kids and get on with life. I really do believe she wanted to take her own life seriously. Hello, Linda. Okay, so... Let's see. I know, so what happened after an hour and a half? I don't know. Maybe it took him an hour and a half and he finally passed out. I don't know, right? One thing that may be working against her is all of the mommy groups she belonged to. No, she's got a lot of support, B-Lady. She does. She has a lot of people that support her, a lot of groups that support her. Yeah. Okay, so let's see. First, let me just go through the testimony so that I didn't miss anything, but then we're going to go through the court of public opinion because I think it's relevant to look at what the court of public opinion says, right? You know, and she wore the glasses after. She didn't come in with the glasses. The glasses were an afterthought. I don't know what's going on with that. It's almost to me, I'm getting, oh my gosh, I was going to say Jodie Foster. Jodie Arias vibes. Remember Jodie Arias came in trying to look like a little mouse, little no makeup, her hair just like no style, the glasses, yeah, like a little mouse. Is she trying to look like a little church mouse or something with the glasses? What's with the glasses? They're only on sometimes. I don't know. Okay. All right, so let's see. I'm going to forget some of these journal entries, hopefully I know. So, they, go to the beginning right here. So I want to make sure we got everybody. Okay, first prosecution witness was Dr. Michael Snyder of Beth Israel, and he treated Cora Clancy, and he explained that they never were able to resuscitate her, and they talked about, her time of death, and that was pretty quick, and he was excused. And then the second doctor that was testifying was Dr. Andrew Capraro. He works in the emergency department of Boston Children's Hospital. On January 24th, he said that he heard that there was a child coming in from Beth Israel, and that he was, versed on it, what was going to happen, what's been happening with the child. He was cold on arrival. He was quite limp. Pupils were fixed and dilated, not a good sign. And he had ligature marks around his neck. And he talked a lot about how he treated him, and, like I said before. And then Dr. David Cassavant of Boston Children's Hospital, he also took care of Callan Clancy. He said Callan had a severe neurological injury, and they did these exams to determine if he was brain dead. And it ended up, yes, that he was, like I said. And he talked about their end-of-life care, and ultimately it was determined that he had no neurological activity, and Callan was removed from the life support on January 27th, 2023. Then that was the end of his testimony. And then we had Lindsay's doctor. We had Kelly McDonough. She's an emergency medicine physician at South Shore Hospital. She was working in the emergency room when Lindsay Clancy was brought to the hospital, and knew that she was unresponsive, found down outside of her house. She said the ER staff was also aware that Lindsay Clancy had a spinal injury. McDonough said she saw no obvious signs of a head trauma or a head injury when Lindsay arrived in the emergency room. She said she did observe superficial lacerations to the neck and wrist. Photos of Lindsay's cuts were shown to the court. And let's see, McDonough said, and I quote, "I think the main concern was for head injury and or spinal cord injury." Then she was cross-examined. He didn't usually, Reddington, Kevin, doesn't usually have questions for these people so far, the first responders and medical personnel, but he did have a few here. I said, was she responsive? Not verbally. She was responsive to pain. And then Reddington asked if people with severe brain activity can react to pain. And McDonough said that is a possibility. He also asked if Lindsay Clancy regained consciousness at all while in the emergency room, and McDonough said she did not. And then McDonough so she was done with her testimony after that. And then after that, you had Sergeant Rose Stofers of the Massachusetts State Police. She works in the crime services section. She gets to the crime scenes to document the scene with photos and videos and collect evidence. At the time, she was working out of the Lakeville office. Okay, so she was called to South Shore Hospital around 8:35 p.m. And let's see. Stover said at one point she tried to pull Lindsay Clancy's arm from beneath the blanket, but Lindsay Clancy was uncooperative and struggled with her. She said there was a red-brown stain on her hand and gauze on her wrists. Stovers removed the gauze to document the injuries and said she did observe injuries. She said that on February 6th, she was called to the Plymouth District Attorney's Office Detectives Unit to photograph a bag of medication and some documents inside the bag that had been brought to their office. And then she was excused. Defense had just a brief question. Let's see now. And then, let's see. Prosecution, request sidebar. They took their morning recess. And then a nurse, so this is when the nurse came in, and she was taking care of Lindsay at Brigham Women's Hospital. And they asked her a lot of questions that she couldn't answer. She's like, that's not my department, not my specialty, that's not my, I'm not in charge of that, in other words. And they talked about the first time she interacted with Lindsay Clancy, January 24th, when she came to Brigham from the emergency room after having been seen at South Shore. And the nurse said she was the main nurse who was assigned to Lindsay Clancy's care on her first night there. Lindsay Clancy was intubated at that time. And while Lindsay was there, the nurse said that her blood pressure dropped and she coded. And the medical technicians ultimately brought her back, and that she was not responsive at all during the time that she was treating her, but also noted that she was sedated. She also testified about interacting with Lindsay Clancy 2 days later on the 26th. She was still intubated, but she could communicate with her somewhat, and Clancy could follow some instructions like squeezing her hands. She treated her then again 4 days later on January 30th after she was no longer intubated and no longer sedated, but said that her emotion was flat, no emotion either way. She said that she was alert and oriented, and she said she was having trouble sleeping. The nurse also treated Lindsay Clancy on the night of February 2nd and said that Lindsay asked the nurse if she could reach out to her lawyer. And then Kevin Reddington questioned the nurse, asking if Lindsay Clancy went into cardiac arrest shortly after arriving. And the nurse said yes. She's also being asked to describe in greater detail the blood transfusion that Lindsay Clancy received due to acute blood loss. And she also testified that some clear fluid came out of Clancy's nose, which they believed to be spinal fluid. And then Kevin Reddington asked if the nurse knew that Lindsay Clancy had a history of postpartum depression or psychosis, and the nurse said, oh, she was aware of that. So let's see. Then Megan Collins was another intensive care nurse that took the stand. She said she was working trauma surgery ICU 7 a.m. to 7 p.m. and she cared for Lindsay Clancy. She took over for the nurse that had previously just testified, Amandi. The previous witness, when she signed on in the morning and was told that Lindsay had coded overnight, the nurse told her that, that your patient had coded overnight. She said she was focused on Lindsay Clancy's injuries and keeping her sedated, so her interactions and responses were limited, but said that that was expected since Lindsay was sedated. She also said that once Lindsay was extubated, she had to be restrained because she was picking at tubes and she was exhibiting signs of confusion or delirium, which is called ICU delirium, over the next few days. But she said that confusion and agitation improved. She said that on January 29th and 30th, the psychiatric consult team came in to speak with Lindsay and evaluate her mental status. And at that point, Lindsay was looking to change her healthcare proxy, like I just told you earlier. But they first had to determine if she was mentally stable enough to make that decision on her own. Let's see here. She was ultimately transferred to another unit on February 3rd, after which time this nurse Collins had nothing to do with her anymore. Then she was cross-examined by Reddington, and he asked who Lindsay was changing her healthcare proxy from. She was changing it from her husband to her parents. Reddington asked if Lindsay said she did not want to be resuscitated. Collins said she wasn't privy to that knowledge, and then she was excused. And then Dr. Shaw came on. She was the next witness. She's the Associate Chief of Division of Psychiatry and Medicine at Brigham. Shaw said she interacted with Lindsay on January 29th, and it was the first of a few times that she met with her. She said that she was seeing Lindsay Clancy for psychiatric safety assessment following the suicide attempt. And let's see what Shaw said, that she asked that day, she was asked that day whether she was able to make the decision by Lindsay to change the healthcare proxy from her husband to her parents, which involved evaluating her medical decision-making capability. We wanted to make the change. She said, we waited to make the change until the next day for a variety of reasons. We wanted to make sure that decision was consistent over time, and because she had just undergone a serious medical procedures, a number of them. A day later, when she continued to make that choice, they cleared her to do so. Shaw said that she also spoke with Lindsay as part of an ongoing psychiatric safety and medical evaluation in February, when Lindsay Clancy was going to be transferred to the Spaulding Rehabilitation Hospital. She said she had no suicidal or homicidal ideations at the time, and she wasn't suffering from confusion or disorientation, and she was looking forward to moving to Spaulding. Shaw described her mood as okay, and she was future-oriented. Several days later, Shaw spoke with Lindsay again and said Lindsay was feeling down. Again, she had no suicidal or homicidal intent or ideation, and she was not experiencing any hallucinations. February 22nd, 2023 was Shaw's last visit with Lindsay Clancy, and she said that Lindsay was hopeful, future-oriented, and had no suicidal or homicidal ideation. Then the cross of Shaw. And he said, from your testimony, was she an honest patient? Yes, Shaw said. So, this is not, in your opinion, someone who was trying to exaggerate her conditions for some legal reason, correct? No, said Shaw. Reddington also asked, that's crazy. I'm reading the exact quote, right? He goes, so, this is not, in your opinion, someone who was trying to exaggerate her conditions for some legal reason, correct? And Shaw's answer is no. Should be yes, right? Yes. Good night. I love you. Should be yes. That she wasn't, right? But she says no. He also asked about Shaw. He asked Shaw about the medications that Clancy was taking, including an antidepressant. He was asking several questions about other medications that she had been prescribed, going back before the incident, trying to get at the quantity of drugs that she was taking. There was one time where, there's that noise again! I just heard it. Yeah! What the hell is that? Hold on a minute, guys. Hold on. Oh my gosh! Don't say anything, I gotta get this. I thought that was one of you howling, or it sounded like a scary movie. It does sound like a
How
werewolf.
far was it?
Be quiet. Be quiet. Be quiet. It was unbelievable. You could hear it on my live. I thought it was a werewolf.
Well, Dad, come over here and listen.
You gotta be quiet. You can't talk.
I know. It's like a werewolf, right?
Yeah, it's unbelievable. I thought you guys were fooling around up there. You could hear it on my live.
I don't know how Dad can't hear it.
I don't know. That was so bad. That was the worst I've ever heard.
No, I heard it bad the other night. Before you guys were, I don't even know how you guys thought that was a human. It sounded like
Can
a
you hear it?
freaking
It
werewolf.
sounds like a werewolf.
Dad, it sounds like, it does not sound like.
I thought it was a horror movie.
Yeah. Dad, where are you going now? Now you're not gonna hear it no
No,
more.
shit, look out the window.
Oh, what window? Not
Any
mine.
window.
No,
I won't
Dad,
open the window. Don't worry about it.
please.
Okay, I'll tell you if I hear it again. I can't believe that.
Just listen for a little bit, please.
Maybe when I...
I go to bed. I get up tomorrow morning.
Me too. I gotta be up at like 6 something.
Okay, God, did you guys hear that? Let me see if they heard it on the live. Let me see. Hold on. Wait, I know. I just wanted... Did you guys hear that on the live?
I might come in and get us.
Wait, be quiet for a minute, Jimmy. Did you guys hear that noise on the live? Here, I'm going to listen. That weird noise again. That's why I am... Yes, right. Yes. Good night. Like a scary movie. Hold on. Including an antidepressant. He was asking several questions about other medications that she had been prescribed going back before the incident. I'm trying to listen to it. Get at the quantity of drugs that she was taking. There was one time where... There's that noise again! I just heard it. Yeah! What the hell is that? Hold on a minute, guys. Hold on. Oh my gosh! Don't say anything, I gotta get this. I thought that was one of you howling, or it sounded like a scary movie. Okay, that's so weird. All right, we're gonna have to just... it was like a howling. If you could hear this where I was, it sounded like I thought the kids were punking me, because when they got home from work, they said, "Oh, wow, Mom, we heard the noise really bad tonight." And then Ethan yelled and it stopped. And now you would imagine that came out of like a werewolf movie. No, there's also a low howl, B-Lady. Well, we'll listen. Maybe they want to hear some more about Lindsay Clancy. I don't know. Okay, so let's see. All right, so then Kevin Reddington asked Dr. Shaw about the medications and several of the other medications she had been prescribed since before the incident. Oh, that's what I was telling you. He said to her, they said something before the incident. He's like, "What do you mean incident? 3 children were killed." And I'm like, yeah, he went off on somebody trying to get the quantity of drugs she was taking. The prosecution noted, however, that Clancy did not take many of the medications that she had been prescribed. And they've made a big note of that almost all the medication is in the bottles. Okay. And then a forensic psychiatrist who met with Lindsay Clancy when she was in ICU at Brigham came on the stand, and he testified that she communicated by writing. She described her mood as horrified, and she seemed very anxious. And she also wrote, "Do I have an attorney? Is my body broken? Are my legs straight?" And if she could have visitors. And this psychiatrist's job was to determine Lindsay Clancy's suicidality, head of surgery, but she didn't see any symptoms of active psychotic disorder. Then on the cross-examination about her experience treating psychosis, maybe this is the one here, the doctor noted that illness can present differently in different cases. She specified that her visit with Lindsay Clancy was about 20 to 30 minutes, and that she saw in Clancy's record that the woman had postpartum anxiety. The doctor didn't recall seeing that Clancy had gone 48 hours without sleep, or that Lindsay had asked another doctor if her brain was broken. She said she would be concerned as a doctor about homicidal ideation and knew about an event involving Clancy. I think that's when he went off and said there was that was part of Clancy's lawyer pressing the doctor on her recollection of the record and how much she'd known about Lindsay Clancy's condition at the time of speaking with her. Asked about Lindsay Clancy coding when doctors needed to intervene with her health for a serious incident and other medical treatments. The doctor appeared to be referring to the surgery Clancy was due to get and didn't discuss knowing about any other incidents. And then she said, I don't know if I had all the records, confirming that she reviewed the records she did have. And asked about her comment about the lawyer, she said that Clancy was exhausted. Final question for the doctor. Reddington asked if she was focused on much of anything in her state of exhaustion, and the doctor confirmed she wasn't. And then Duxbury Patrol Sergeant Robert Flynn took the stand. He was a detective at the time that the children were killed, and he told the prosecution that he recalled hearing screaming on a radio from a chaotic scene. He said he'd been told about a mother apparently killing her children. He described what he saw on a sweep of the Clancy's house. He said he saw food on the couch, suggesting a young child lived there. Patrick Clancy was at the house at the time, but was taken to the hospital while Flynn was there. Kevin Reddington didn't have questions for him or another witness. Massachusetts State Police Sergeant Mark Farroyle. He testified briefly about passing along blood and urine specimens taken from Clancy to a crime lab technician. And then Massachusetts State Police Crime Lab Technician Lee O'Connell answered a handful of questions about her samples and how they're handled in crime investigations. Massachusetts State Police Captain John Santos. It's very funny. Reddington is the only one. He'll go like this. I don't contest to any of that. I don't contest the change of command. Don't even ask me for objections. Don't even ask me like when evidence is admitted. Like he does it. He's like trying to really streamline it. And I think like, well, he's 75. You know, he's trying to like, all right, I'm not going to life short. Let's not waste it on this stuff. Like I notice that he just lets a lot of things like just like, oh, let's not. We don't need all these formalities. And one thing I notice is when they finish, if he does have a cross-examination, boom, he just up and goes. And the judges work with of course, with Kevin Reddington many times, and he said he worked with those prosecutors many times too. So, like, he just goes, like, some judges are really sticklers. Like, you know, they won't take an objection unless the lawyer stands, you know, so all of that. But this guy just seems like, you know, because you see, like, Reddington just jumps in. You ever see how quick he jumps in? Like, the prosecution hasn't even made it back to their table yet, and he's, like, up. Usually, the judge will look over and say, cross-examination, Mr. Reddington, you know, yes, I only have a few, you know, but sometimes he just gets right up there, especially if he does a recross. He's just, like, right on it. It's crazy. Okay. Let's see, where was I now? I was on John Santos. They detailed the evidence that he uncovered, including the books that had previously been discussed in the trial. He described the process for searching crime scenes like Lindsay Clancy's house. On cross-examination, Santo was asked about, again, the watch and everything, why that was not taken, and he said, well, someone else probably was searching that. Then Corey Mello took the stand, then another Massachusetts State Police officer, and he reviewed Lindsay Clancy's writings. And in one, she wrote that she had become obsessed with Callan sleeping after he cried for over an hour and a half one night, noting that she told Patrick she wanted to die. I'm completely overwhelmed trying to take care of the 3 kids, she wrote in the journal. She also described it like, my mind is trying to make something physically wrong with me. Let's see. And that was like to escape. I think she had that also went on and said to like to escape that. let me get some more of her, see if we can get some more entries in her journal. Okay, so so yeah, there's an attachment parenting for littles. She was apparently a member of this group, and she put in there, I am looking for some advice, solidarity, something, anything. I am truly finding my 19-month-old to be the most difficult human I have ever encountered. I mean that with all of the love in my heart. I'm sorry. Do you know how many mothers can feel that way about, especially a soon-to-be 2-year-old? Yeah, that's why they call them the terrible twos. Yeah, it can be really difficult. I think if you've had kids, you've all had an age where, if you have more than one, unless you just, have this like model child, but if you've had different kids, you probably have had some that have been more of a challenge than others. And you've worried about them and thought, oh, is it difficult? Or maybe I can't manage this one. Maybe, my gosh, I don't think that is out of the ordinary. I know, like, my mother would even talk about how her first child was like model child, and then the second child, I'm sure he had ADHD, okay, but he was completely different and all over the place. So many parents could have written this. This is not what is, because it's not that she killed her kid. I don't know. I don't even know why that we're on this, because now, what I'm afraid is going to happen? Now you're going to get so many people going, oh my gosh, I thought that about my child. Oh my gosh, should I go commit myself? Well, I'm going to end up killing them. These new mothers. Come on. Okay. So I want to see the responses to this, because I guarantee you she probably got responses that were, telling her, look, I had that with my 2-year-old. He's 10 now and he's great, or whatever, Anyway, she says, I'm truly finding my 19-month-old to be the most difficult human I have ever encountered. I mean that with all the love in my heart, but I honestly cannot make it through a day without getting so frustrated with him. He's not my first child, so not to compare, because I know that every child is different, but just for background, this isn't my first rodeo. Every single thing with him is a battle. Joan Crawford said that too. You negotiate everything like a Hollywood agent. And if it had been this way for a while, maybe since he was 8 months old. I really try to pick my battles and only do what's completely necessary, but I mean everything. Getting out of his crib in the morning and going downstairs, changing his diaper, getting him dressed. There's tons of... mothers out there, do you know kids like that? Have you had kids like that? I think we either know them or had kids like that, right? Everything's a battle. In fact, my brother, who was the second one my mother had, she said one of those, oh, I hope you have a kid just like you. He did. And I was in charge of taking care of him a lot, okay? We were like 7-8 years apart. And so, yeah, and he would do things like we'd be riding bikes and then he'd just throw the bike down and went through the woods. Okay, crazy things like, but yeah, he turned out to be, a good dad, a good father. Yeah, but you had to get through that crap. Yeah, he had the ADHD too, really bad. He was all over the place. And yeah, he was difficult. But I'm saying that, you could, that's kind of normal. There are a lot of children like that. It's not like they're like, oh my gosh, really? Anyway, every single thing with him is a battle. I really try to pick my battles and only do what's completely necessary, but I mean everything: getting out of his crib, going downstairs, changing his diaper, getting him dressed, getting him into the car seats, getting him to the car seat, getting him in and out of the car seat, putting his jacket on, going to stores, okay, putting his shoes on to go outside, having him come inside when it's time, going to sleep for his nap, and at night he fights me every step of the way. With all of these very normal daily activities, it constantly feels like I have to force him to do these things, which feels so wrong, but he is always fighting me and crying about doing these very normal things. I wonder what the reaction to this was, okay? And then apparently there's depression and anxiety and rage. Lindsay Clancy, November 8th. Looking for advice on medications, PPA, PPD. I tried Zoloft, and after taking it for a week and increasing to 50 milligrams, I had extreme insomnia and also felt like it was worsening my depression, and I had no appetite whatsoever. She wrote that in the journal. This is the journal entry. I think, well, it sounds like the journal entry, but no, it's an entry in one of these groups, but she has a very similar one in her journal. So I had to stop taking it. Has anyone had a similar experience and found a different medication that worked? Also, right now, I feel like the only medication that works for me is Ativan. That's why she thought she had a benzodiazepine addiction or something, right? It has the perfect effect of decreasing my anxiety and making me feel happy. It makes me feel like myself again, but I know it is not a long-term solution. It is also addictive. Any advice on the alternative that has a similar effect? Excuse me. Hiccups. Don't get the hiccups now. And a Crunchy Mama post, let's see, he says, I was so against it as well. With my first, we never did any sleep training at all, and she didn't sleep through the night ever until 15 months. And even after that, it was still hit or miss. When my second started waking every 45 minutes the entire night when he was 3.5 months old, I knew we needed to help him sleep better because we couldn't survive like that. We didn't start sleep training until he was 4.5 months old, but it honestly was not as bad as I thought it would be. Before training, he would either fall asleep nursing or rocking, so part of the sleep training was to get him to fall asleep in his crib. I did this by putting him in his crib and staying right with him, talking to him and rubbing his back until he fell asleep. He did cry the first time. Let's see, and then this is the journal entry now. I think I sort of resent my other children because they prevent me from treating Cal like my first baby. And I know it's not fair to them. I know that I was feeling depressed last evening when we've already gone through this one. Cora and Dawson came home from school. I know it runs off on them, so we had a pretty rough evening. I want to feel love and connection with all my kids. I wanted to ask all of you that you find it deep within yourselves to forgive Lindsay. Oh, that's what Patrick wrote there. Okay. All right, let's get to... Someone said, these read as someone with lifelong expectations about what motherhood should have been, instead of being, inflexible with the reality that having kids is not like playing with dolls. Parenting is not always sunshine and roses. Resentment quietly built over time. I could see her being someone who thought she was doing everything by the book, reading everything she could about parenting, posting in parenting groups, and being frustrated that things were not going as planned or were more difficult than expected. She was the expert after all, and I'm sure Patrick put pressure on her with that as well. In the New Yorker, he indicated that not understanding why a nurse like Lindsay would be seeking advice from random stay-at-home moms on Facebook, that probably weighed on Lindsay and increased her anxiety about struggling with motherhood. There's a difference between being empathetic and attuned to your kids' needs versus being book smart or researching as much as you can about babies and kids, what to do if XYZ, and having all the answers. She also strikes me as struggling to connect with her kids overall, and being more interested in pregnancy and the baby phase, that beyond that, parenting requires relinquishing the expectation of control to some degree. Kids behave unpredictably, and flexibility is required, as well as emotional regulation. I believe this is where she may have struggled. I also think that Patrick, directly or indirectly, put more pressure on her than we know, and she also put pressure on herself, and this contributed to her mental health decline. I still believe she lost it that night in a moment of rage and overwhelm. I don't think it was a moment of rage at all. Not one bit. I do think it was planned, and I think she planned to take herself out with her kids. I think she just didn't want to go on anymore, and she did want that, you can call it control, of not wondering what was going to happen to her kids. Who was going to take care of them? Who was going to do this, or what was going to happen? Someone said, I agree with most of this, but I do think the final straw was her imminent return to work in 2 days to work. She made it clear in her journals that she did not want to go back. Patrick said it gave her anxiety. She had already tried to return once and had failed. She could have had a resentment with him that he wasn't saying, look, Lindsay, just stay home, right? But then here's the thing. If she's so overwhelmed with her children, going to work might have been a way for her to, get a little break from it and do something different. And maybe it was going to be good for her. But she's done that before, so she should know that, I don't know. So yeah, I struggle with trying to figure that out. But the other thing is, she could be resentful of Patrick because he did say something in one of the lawsuits. It said that Patrick said he didn't think she would be happy if she gave up her job. So maybe maybe in some way, even if it was subconsciously, the whole thing she was doing was also to punish him, because I said, why wasn't she thinking about him, and she has taken away his children, what he was going to come home and what his life was going to be like. Maybe some subconscious way she wanted to punish him because he didn't say, it's okay, just don't go back to work. I don't know. But she also didn't seem like that he ran that household. Okay, you see him with the diaper bag, he looked like, yes, yeah, he's just, yes sir, yes ma'am. Okay, anyway. Patrick said it gave her anxiety. She had already tried to return once and failed. I believe that she tried extremely hard to get a PPD diagnosis so that she could go on long-term disability and still have money coming in because she could not afford to quit her job. And she also carried the family's health insurance. I think there is always truth in lies, and I think Lindsay's saying, a man told me it was my last chance. Yes, it was her last chance to do something, or she would have to go back to work. I don't think this was a spur-of-the-moment snap, since she had previously searched ways to kill, and sent Patrick out at the exact moment that she said she heard the man's voice. She said she would have had to have planned, she also would have had to plan this meticulously, which was her style, to get it all done before Patrick got back. She timed it. She knew she'd have to start as soon as he left, which was why she seemed so rushed when Patrick called and why she hurried to get him off the phone, which was also why she had called the pharmacy before he left, checking if they had the medication for Cora so that Patrick wouldn't call her, but that's meant he did anyway. Before you think it's crazy, I work with a very normal, very happy woman who had a 5-year-old daughter and just had a baby boy. She had a very demanding job, and her husband had just started a business and was on full commission, so she had to work. She didn't want to go back to work. The night before she was due back to work, she ran out of the house into a park and shot herself. She had no symptoms of PPD, PPP, and never complained of that. The stress of having a baby and another child and a demanding job and the pull to stay home put her over the edge. The difference, she didn't harm her two children, which is what Lindsay should have done. But Lindsay didn't want to end her life. She just didn't want her kids anymore. They were too much of a hassle, and she wanted her me time back, and she constantly complained about losing that because of them. I hate that she's hiding behind PPD and PPP as her excuse for what she did, and I hate how many gullible women there are that are just blindly willing to give her a pass because she and her attorney, who have a huge motive to do so, says she hadn't, although 8 competent providers said otherwise. So this is the first time I've seen anything about Lindsay Clancy. Okay. He testified today that they had money saved to push her work date. Yeah, they said but he also said that she should go back to work. I think it was in the New York article or it was in the lawsuits. I agree. Also, Callan was 8 months old, right around the point that Lindsay said Dawson started being frustrating. Speculation, of course, as they called him Happy Callan. But we have no idea how it truly was behind closed doors. And my personal opinion, which I don't share often, is that she wanted another baby because she wanted a fresh vessel to pour her narcissism into. Take more time off from work, not have to watch all of the other kids, and use a nanny while she gets her baby days back and her time for self-care. Okay, let's see here. The poor Lindsay community is acting like there was no motive, and the usual motive of resentment, anger towards the other parent or spouse is not an issue in this case. Therefore, it's obviously PPD, PPP. I find it interesting that after the horrific deaths of his children, he moved to NYC, got an apartment, and started running a marathon and hanging out. No. He ran marathons with Lindsay. Running marathons is something he did. He was very active. He played musical instruments too, a lot of them. So you're wrong, whoever you are here. And hanging out with other men whose wives committed filicide. Is she talking about the Yates? She wasn't hanging out with him. This you got to be really careful of people that think they have some information. Okay. Okay. Oh, she's saying that he has met and talks to other men whose wives have killed their children like a support group. She said it's in the New Yorker article. So if you went to a support group, your client, oh my gosh, I just can't. Okay. I'm not even going to get into this whole crap. I want to go to the journal entries that they read today. Okay, let me see here. Being non-compliant with treatment, okay. Oh my gosh, conspiracy theories that the husband did this and framed Lindsay. I'm trying to, okay. Trying to find where they gave her absolute journal entries here. Let's see. What's up? What's up? All right, here. Okay, this is hopefully maybe has what I'm wanting. Okay, the journal entries read by her attorney sound like what any new mother or mother of multiple children has gone through. Sleep deprivation, questioning if you're a good mother, fatigue, not feeling like yourself, etc. I think he was reading them to elicit sympathy, but it did the opposite for me. It sounds more and more like taking care of them was getting to be too much and she couldn't take it anymore. Let's see. There were no ramblings of nonsense. What?
Turn the gain down there, Dan.
Why?
It's too high. You can hear the water trickling from the. I'm gonna go here in turtle tank.
But how do you know you can hear it?
I just heard it upstairs.
You heard the water from the turtle tank? Because Scooter always says she can't hear me. I think she does it. I think she lies since they're kids me or whatever. She always says it. I can't hear you. I can't hear you. She always does that. It makes me turn the gain up. It's a game she plays. Okay. There were no ramblings of nonsense like you would find in the journals of someone experiencing psychosis. What are you talking about, turtle tank? We don't have a turtle, Jimmy, remember?
No,
It's just fake.
Okay.
Remember, we don't have... Sorry, I couldn't resist that one. Exactly. Very coherent and formulated analysis of her thoughts and feelings. It didn't sound like depression. It was full of anxiety. Okay, let's see. Made it sound like the lack of control was making her upset and that she was very done with the mother role, and that's how it came off to me. She said something to the effect of her mind was looking for a sickness within herself so she'd have a reason for not wanting to parent them anymore. Many moms, including myself, have had the same tough issues in motherhood, like babies not sleeping. Of course. What about a baby with colic? Could lose your freaking mind when breastfeeding doesn't work out. Absolutely. I went back to work at 4 weeks of my first child. It was gut-wrenching. We decided to postpone buying a house and saving up so I could stay home. Cried every day, went to work 5 days a week, and pumped every couple of hours on very little sleep. It was horrible. I had a very supportive husband. We made it work so I could stay home. He was the higher earner, and I was nursing. Okay. It did the opposite for me, too, someone said. How is she sick of taking care of everyone when she wasn't working for months and had an extensive maternity leave? Had a husband working from home, had a daycare for her older kids, had a nanny at home for the baby, and had what I call massive help from her family and Patrick's family. She comes across as spoiled and entitled for writing that she's tired of taking care of everyone while having what I'd label as a massive village. Some of us out here literally have zero help and no village, and truthfully doing it on her own, yet she's the victim here. I was so confused if the journals were supposed to help her or the prosecution, because after hearing what she wrote, I don't feel much towards her being a victim now. this was exactly how I felt. Like, she honestly just didn't like her kids or motherhood because she was hardly ever with them, and with them alone even less. Someone said, I totally agree. Neither my parents or my husband's mother have helped us. We could not afford daycare or a nanny. It honestly makes me a bit jealous to ask the help she had, and it still wasn't enough. I forgot to add how Lindsay never went back to full-time work after the first 2 children were born. Didn't Patrick testify this in the first days of her trial? She did part-time after 1 child, and Patrick said she did 1 shift a week after the 2nd child. So what is that for an RN? 12 hours spent working per week. Come on now. This is the aspect that pisses me off. How many of us have felt tired, burnt out, at the end of our rope, suffered from depression, anxiety, grief, and had to work full-time and be the main caretakers with 0 outside help or help from a partner? Someone said I have the same amount of kids as her and closer together in age with no help either, paid or otherwise. Husband worked full-time outside of the house. No daycare, no nothing. She sounds weak. Someone says, look, I don't condone what she did. But just because you coped, it doesn't mean she has to. Mental health conditions do not relate to circumstances. That is why you get people who are severely depressed, even though they have a perfect life and no problems. Some conditions, hold on a minute, are literally caused by a diseased brain, just like how the other organs can become ill. I don't know if she was bipolar or depressed or whatever, but if she was genuinely mentally ill, it doesn't really matter how much help she had. You don't tell a person with a broken leg that you managed to hike a mountain without a walking stick, and therefore they should be able to as well. Sane people who are overloaded and tired do not kill their children, and most mothers are overloaded, sleep deprived, and get through it. She had something else going on. Again, I'm not on her side or defending her, but the lack of understanding about how mental health conditions function is astounding. There's a major difference between normal feelings of sadness and overwhelm that we all get, and actually mental illness caused by a brain that's not functioning properly. Mentally ill patients are not weak, they're unwell. Someone said this, there's a lot of I pulled myself up by the bootstraps, old-fashioned ideology about mental health. Heck, even millionaires commit suicide, and they've got it pretty nice too. Okay. This is her 3rd child. She's a labor and delivery nurse. She's had tons of support. I don't mean to be snarky here, but why not just tell Pat that she can't go back to work? She states that the brain fog and exhaustion makes her anxious and about working outside of the house. Pat testified that she didn't have to go back to work. He had some savings and that he worked from home. Make it make sense. I don't believe that Patrick was forthcoming about her having the option to extend her maternity leave. I think she had already taken more leave, she did, than was originally planned for, hence the entries about spending money and letting go of the nanny. And if I read between the lines of Patrick's public statements, he wasn't fond of stay-at-home moms. I also don't think she had a serious discussion with Patrick about not being ready to go back or not wanting to go back. Was she going back to an overnight shift? What sacrifices could they make to have her stay home a little longer? Could they cut down in 1 car, eat at home more? My husband and I have had 1 car for 15 years and lived in a modest home to make it work on 1 salary while our children were little. 3 little kids were bound to be sick on a regular basis. School pickups, it sounds like it was too much for her. Well, that was another thing. And she said, oh, they're going to get the baby sick. I mean, a lot of mothers struggle with that. I remember that when my first 3 were little, and when Alexandra went to school, then all of a sudden she was bringing home everything. Ray would get it, and then I'm like, the baby would get it. And I remember I was sitting at the kitchen. I said to my mother, somebody said the throat hurt. I go, oh my gosh, how long? And then the pediatrician told me, yeah, this is like how it goes for a long time, and then they'll build up immunity and they won't be sick all the time. But yeah, when you have a new baby, what they did is Alexandra went to school, brought the chicken pox home, because this is before the vaccine, and they got it it was in the winter when you're trapped up here. There was no internet, nobody to talk to. Okay, my husband worked full time, 12 hours a day, and I was up here, and it was exactly the full 2 weeks incubation, right? So she got it. She got one of the worst cases. We were in the hospital. They couldn't get an IV in her. Her veins were rolling. They stuck her for 2 hours and never even cried. We were watching the ice skating. She was 6 years old. And then she gets out of the hospital. She got Coxsackie virus on top of that because her immune system was low. After we almost said, okay, when nobody else got this, the Ray came down with it. He didn't go to the hospital, thank God. She also had 105 fever, and it was going higher. So then he had it, and it was still bad. Then the baby, Michael, got it. And I remember I even changed the message on my answering machine that I can't get to the phone right now because I'm all wrapped up in, I'm all covered in calamine lotion. And so, because I just thought you'd have to have some humor about this. But yeah, it's crazy. And yeah, that is a very real thing. When your kids start going to school, yeah, they start getting sick. And if you've got younger kids and babies, that's the whole thing. Like a lot of the pregnancy anxiety I had was always like, what are they bringing home? And you're pregnant, and then every pregnancy book scares the crap out of you. Don't get FIFSTDs, don't get CMV, or your baby could have all these birth defects. That stuff scared the crap out of me. So, but then, your kids get to a certain age and they've built up immunity. But yeah, what mothers don't go through those thoughts? Oh my gosh, they're going to get the baby sick. Some of them don't. And my mother would say, no brain, no pain. But most mothers, think of that, and it's hard. And now, at least she had internet groups she could go to and stuff. We didn't have anything like that. You had your friends, and that was it. So yeah, you could find like specialized groups for what she needed to talk about. So yeah, these mothers are saying this, the things that the mothers go through. Okay. How did I even get on that? Oh, about what she said about the kids getting sick. Okay. Let's see. My first child, I couldn't sleep because I thought he would get SIDS. I literally would pop awake every 2-ish hours, check his breathing. Like those entries, I feel like a lot of women get their kids, but I think she couldn't handle it anymore and wanted out. None of the entries read today show me she was suffering from any psychosis. I feel Reddington doesn't understand this and hurt their defense. Okay. Someone said it was a way to hear Lindsay without having her testify. Testify to what? If there are mothers on the jury, they will all have been through something similar without strangling their children. Someone said, my mom didn't have postpartum psychosis, but psychosis nonetheless. My younger brother, 14, and I, 12, were both diagnosed with late-stage cancer within months of each other, and every day was a choice between showing up to my 8-hour surgery or his 11-hour surgery, chemo, radiation, all while trying to hold down a full-time job so we had the health care to get treated. She showed no signs of psychosis at all. Yes, she saw psychiatrists, therapists. She was put on numerous medications like Lindsay. She complained why she didn't feel normal while holding down a full-time job, where she even received a promotion while all this was going on. And after she finally broke and tried to hurt us and kill herself, did her coworkers come forward and say they never suspected a thing. She showed up smiling every day to work, completed all her tasks, could come home, make us dinner, help us with the homework, and then one day she just completely snapped. I have complete sympathy for this woman because later on, my family and I found out she was breaking apart and keeping it all to herself, as well as telling her healthcare providers she was not feeling well. You people need to stop judging her. Yes, my mom didn't kill us because the powers that be stepped in before it could happen, but it definitely could have been my brother and I, and she is an amazing mother. She was just failed by every mental health provider she was begging help for. Someone said, so you're projecting your mom's mental health onto a complete stranger who has a completely different circumstance, a woman who strangled 3 children to death, and one of them had blood coming out of various orifices, another with brain swelling. Lindsay was begging for help by checking herself out of the hospital to go to a birthday party, lying about her care at the hospital and not asking about the kids, but worried about her body and getting legal counsel. Very weird. She said, I'm not projecting, I'm just stating parallels that I saw in my personal experience, as well as being an MFM nurse. My mom had a journal similar to the one discussed in this case, stating she was overwhelmed, felt completely alone, self-harm. They just kept changing, giving me more meds. Besides my personal experience as an MFM nurse, I can't tell you how many women like Lindsay Clancy came through our practice and was treated as an annoyance rather than a human being. I am in no way justifying her killing her children, but I'm stating her care and women receiving care in these cases are improperly, if not completely, incompetently handled, and she's a victim of that. There are many more people, including healthcare professionals, that need to be charged as well. Charged with what? And this person told her that she was delusional and that thinking doctors need to be charged with anything. Based on her journal entries, she had the struggles of normal motherhood. I don't know what that was all about. You know, it's interesting, she says to them that they have to stop judging. Is she not? She's judging also, right? She's saying that she's her mother, right? That doesn't even make sense. And it's a trial. They're discussing something. I don't know. It's like some. Does she just want to say that so she can just put an end to the discussion? I don't know. Okay. I want to see something over here. Oh, someone said, we get it, this about her journal. We get it, Lindsay. You don't want to go back to work because Callan is learning to sleep through the night like every other child has learned in all of humanity. They said, but you are special because it makes you feel anxious and guilty. She was throwing the kitchen sink into the journal to get out of work. It's so fake and everyone knew it. The special note to Patrick's mother. Let's see. Someone said, to me, it shows she was perfectly capable of clearly articulating her feelings and actually provided insight to why she was feeling them. Not someone's losing grip on reality or becoming increasingly scattered, delusion, or disorganized. Depression, yes. Anxiety, yes. Feelings of failure, yes. But not psychosis, not even coming close to that territory. Correct, every mother feels these thoughts, and not every mother does what she did to her children. 100%. She just didn't want to go back to work, period. The part about, do I need to make up something wrong with me, was very damning. And no one was buying what she was selling. I don't even think she said, do I need to? I think she said, I think I'm thinking things are wrong with me, or something. It wasn't exactly that verbiage. Her older kids enraged her. Her husband enraged her. Doctors enraged her. Yeah. May think it's a case of a girl who cried wolf one too many times. I'm betting those who know her well are hip to her attention-seeking games, and everyone was like, you'll be just fine. Yep, see, I told you there was something wrong with me. She disgusts me, and the fact that she's allowing her poor parents to be driven into bankruptcy, defending her as reprehensible after what she did. She's extremely unlikable as a defendant, and I think the prosecution is doing an excellent job of showing the extent of her self-centeredness. I think a lot of people in the general public are not hip to these dark personality traits. Also, a lot of people will go to get attention, and how many among us have main character syndrome? As such, this type of attitude entitlement have become normalized in our culture and even rewarded. I can see how many people following this case may just not understand how this type of personality in its extreme leads to criminal behavior. There must be something abnormal going on. Okay. That is the thing about the long-term disability. Did she ever try for disability? I wonder if she ever mentioned that. Someone said she gets no sympathy from me. I had to sleep train twins. I didn't have a nanny. My husband couldn't take 3 months off. I had to go back to work full time after only 14 weeks. It was incredibly hard. I was anxious and stressed too. There's no excuse for what she did. These journals show she was not psychotic. There were no ramblings or delusions or thoughts that were disturbing. Okay. Reading between the lines, she wanted a break. Both scenarios, work or being with the kids, were overwhelming to her. That's the part I struggle with. She wanted a break. Her two oldest were in preschool, and they had a nanny. I have 4 kids, work full-time, and do not have family in the area. Work is my break for my kids. I really do think Lindsay wanted the great, easy lives she saw around her. The reality of having to work plus kids being challenging in general, no matter how many hours you might be able to keep for yourself, probably had her perpetually overwhelmed, upset, and resentful. I personally believe she was having severe mental health issues, severe depression and anxiety. I think she should have stayed at her parents' until she got her medicines figured out. Maybe all she needed was just 2 weeks to focus on her mental health and sleep. But okay. Sleep training a baby is hard for everyone. What mother doesn't feel awful during the cry it out method? Spare me. They are all normal motherhood challenges and feelings. It doesn't prove that she was struggling any more than the everyday mom. I'll never understand the people insisting rather common concerns for moms are not only actually psychosis, but that this case in particular somehow deserves a not guilty by reason of insanity verdict. So many people parasocially chiming in about how much they relate to Lindsay, and yet I'm assuming none of them have ever killed anyone. You need a microphone. Every part of this story is relatable except the ending. The anxiety about the kids, getting the baby sick is a universal experience when you have multiple kids. See? Yeah, it is. Of course it is. She was just voicing what all mothers like that go through, right? Nobody wants their kids getting sick one after the other, one after the other, one after the other, and that's what happens. The evidence of her leaving. So many questions like, why would you sleep train by letting your kid cry for an hour? Why would you claim you have PTSD over that? She comes across dumb in the journals, like shockingly dumb. The cry it out method is a common sleep training technique. It's super hard for the mom. However, claiming PTSD is ridiculously extreme. No mother likes to hear their baby cry. Just an extreme example of her drama queen BS that the poor husband, I'm sure, had to endure all the time. Fully agree, but I think Lindsay was even crazier and more controlling than we will ever know, and that Patrick has his own skeletons in the closet, in which case it makes full sense that the two are protecting each other, even though they know they're both lying. And even though I suspect they might even hate each other, possibly since before the murders. Okay, wow, not too much speculation there from that poster. There are a lot of sleep training methods, including variations of cry it out. We did it with my daughter, and it does indeed suck very bad. It can work if you stick with it, but it isn't very fun in the moment. I'm not her, but obviously never harm my daughter because sleep training sucks. Okay. Now they're going to argue about sleep training, I guess. One thing I noticed is that Patrick seemed really tuned in about Lindsay's use of Ativan. When he was on the stand, he made clarifications about the Ativan found in his car. He may have been the reason Lindsay ended up on the first Valium taper with Dr. Gelada. Lindsay started seeing Dr. Gelada on 11/29, but according to his civil suit, the issue of her Ativan dependence came up at the 12/6 appointment that Patrick attended with her, and that's when the taper was started based on the CVS records. He said during his testimony that Dr. Gelada was the one who instructed them to take the meds to the police station, and he confided in Kyle Carney about her having terrible withdrawal from benzodiazepines in the search warrant docs. Do you think that something like this could have caused discord or resentment in their marriage? Exactly, just like the Dr. Lauren Dickinson case in New Zealand, where she murdered her 3 kids in the exact same way out of rage and resentment towards them and her husband. She also murdered her most difficult child first, who she claimed was very mean to her. It's eerily similar. She was convicted of murder. What's wild is she went through 17 rounds of IVF just to have her kids as well. Wow. But she didn't try to kill herself, right? So I don't know. I'm going to look into that case. Did you guys ever hear about that? Let's look that up. At one time, I don't know what. September of 2021. Maybe we did look it up. All right, we'll put that one. I'll put it over here in the data bank. Did you watch Patrick's testimony? He said he was fine with her staying home. They got rid of the nanny because she was staying home with the kids more. So the entire thing doesn't make no. He was okay with her stay. There's an article I know he says it was not for the long term. He never said that he was fine with her staying home. He said that he put money away in case she wanted to extend her leave, which she did multiple times. I truly don't believe that her quitting her job was ever truly on the table for them. Didn't one of her journal entries talk about her spending too much money? I imagine that's why she needed to go back to work at least part-time. They were considered middle class in Duxbury. It's a wealthy town, and they weren't at the top of the food chain. Yes, the I know I'm spending too much money part stood out to me too. There was a lot more going on behind closed doors. That much is clear. I haven't been at work since the last part of court on Friday to watch the trial on my computer, but I'm sure they weren't rolling in money. They bought the house for around $450K, if I'm not mistaken. Her car is worth minimum used with 45K miles, just for an example, 35K, along with the truck he drove, which was a decent ride, say about 25 to 35K, along with the trips they took. Oh my gosh, this lady's too much. Oh my gosh, I knew he drove a Silverado. I have to go back and look at it. Okay, he gave an interview where he said, he questioned her, yes, this is what if she really wanted to be home 24/7, and said he supported her working part-time. I think there is more that we don't know about their marriage. She journaled about wanting to get the intimacy back. I think he was tired of her anxiety and checked out, and she punished him. Okay. Worrying about those things isn't dumb or uncommon. She wrote that never thinking anyone would read it. If literally anyone else wrote this in a journal, no one would think anything of it. Okay, let me go back to what you guys are saying. Sorry, because I've been a long time. So, let's see. One thing that may be working against her is all of the mommy groups she belonged to online. No, because her postings are just, they're showing, yeah, working against her, because they're showing that is that what you mean, B? That they're normal concerns like other mothers had. Yeah, I don't think her postings in those groups is anything out of the ordinary, right? How many mothers do you know have a child they say is, gosh, I don't think I know a mother of multiple children that has not said that about one child. They say like, that one's the one that, is going to put me in the, whatever, the loony bin, or they say some kind of comical thing, right? That one's the one that challenges me every day. That one is the one that, so many times. I mean, that's not out of the ordinary. She's trying to say everything with this child is a challenge. There's a lot of parents that have a kid that everything is a challenge. And then other ones that are easier, right? Oh, so-and-so's so easy. And then this one is not. That's the way it is, right? That's reality. No one says you're going to have, every baby you're going to have is going to be like, just go on the schedule, do everything you want them to. No, right? I mean, that part of it, I would have loved to see some responses. I bet you there would have been like, oh my gosh, me too. My first one was a dream, and my second one is all over the place. I can't do anything. They don't even sit down and for 5 seconds, everything is a challenge. My gosh. Okay. Andrea Yates got a second trial. Might have been death by now if she didn't. I doubt Lindsay thought she would have to face a trial about her children's death because she figured she would not be alive. Right, okay. Oh, that's a wolf. Debbie's saying that's a wolf. Okay, your dog heard it howling. After a kill, coyotes make that noise as a group. Really? After a kill? No, it's all different times, B. It's been all different times. Sometimes it goes on for a long time. Your dog's still in an uproar around it. B, I think when the medication caused side effects, Lindsay was advised to stop it and start a new one. All the bottles were left over. She gave the impression she wasn't taking her meds as prescribed. Okay. Whoever wrote that is angry and thinks Lindsay is a spoiled brat. Well, which one was that, I wonder? I wonder why it was her male baby who finally put her over the edge. Hello, Justina. How are you? School starts Thursday. Get out of town. That's so bad. But you guys get out early. Are you kidding? We're well, that's crazy. Don't tell me that. Even though I worked while we raised our 3 children, my husband always had magazine subscriptions for me. He never let them lapse, and I always had them to read. Oh, yeah, like your parenting magazines? Yeah, but they always recycle them. My mother always told me that, and then I was like, she goes, wait till you see. They just recycle the same articles. And I'm like, oh, no. And then after, like, they're like, third child, I'm like, she is absolutely right. Okay. Do you wonder what type of emotion Lindsay must have had towards her children to do what she did? I think she wanted to take herself out and she wanted to take them with her. I can't individually tag everyone, so I'd like to... Hi, Jet Set. How are you? Okay. Carolyn, true, but they don't follow up by strangling them. Right. That's what I'm saying, B. I'm saying the things she said are very normal. So if they think that journal or something helps her, I don't think that journal helps her at all. Hi, Ari. Hi. In Florida, school begins the 10th. So, yeah, that's what I'm saying. I think more parents can relate to that. I mean, a difficult child? How many people do you know has had a difficult child? Oh, my goodness. People have more than one difficult child. They could have all difficult children. I mean, yeah. I just think, I don't know what. You know, that those journal entries don't help her at all. Sorry, they don't. Now you're talking about Cannon. Okay, so yeah, I mean, we'll see what tomorrow brings, right? Who else there? She's going to have what? Patrick's mother testify, her parents testify. Who else? The medical examiner is going to testify. Friends. How about wouldn't you have the daycare teachers that interacted with Lindsay at pickups and drop-offs, right? Shouldn't they be testifying? What about the former babysitter, Lainey, right? Shouldn't she be testifying? Who else would you think is going to be there? Their pediatrician. Shouldn't their pediatrician be testifying? How is Lindsay? What about her OBGYN? Right? If she had the same OBGYN that dealt with her through the pregnancies and everything. OBGYN, if you're having anxiety in your pregnancies, they're going to know that. They're going to be treating you like, yeah. Let's see the people that interacted with her, right? Or then her coworkers. And, wonder what Patrick's mother apparently was very supportive to Lindsay. Very supportive. She even wrote about her in the journal. But did you get the one lady that was yelling at all those other ones to stop judging, and then wasn't she judging? Right? Did you catch that one? Let me see about, hold on a minute. I think there is, hold on a minute. Let's look at the potential witness list, okay? Okay, so from the Massachusetts State Police, they have 22 people on the witness list. They have Duxbury Police Department. They have 11. Duxbury Fire Department, they have 11. Marshfield Fire Department, 3. Pembroke Fire Department, 4. Kingston Fire Department, 1. Hanson Fire Department, 2. Beth Israel Hospital, let's see, they've already had Dr. Michael Snyder, and I think they had the rest, I think they had everybody there. Boston's, let's see, they could, there's 2 more I think they haven't had there. South Shore Hospital, they had McDonough. Yeah, 1, 2, 3, 4, 5. Brigham Women's Hospital, they had Rachel Amity, they had Meg Collins, they had Dr. Shaw, they had Dr. Biswas. There's a few there. There's a few more there. Massachusetts General Hospital. They have 2. Then South Shore Health. Then the Crime Lab. Wow, they have like, I'm just looking, just estimate like 20 people from the Crime Lab. And NMS Labs, they have like 10. Hold on. The medical examiners, 3 of them. Commonwealth's experts. All right, they have 4 doctors and someone from Cellbrite. Okay, civilians. Let's listen to the civilians, okay? I feel like I have a... Patrick Clancy, Michael Musgrove, Paula Musgrove, those are her parents. Okay. Allison Ozga that might be, it's from Connecticut. It's probably a friend or a family member, right? Christopher Clancy, Saskatchewan. Susan Clancy, I guess those are his parents, right? Michael Viscarello from Plymouth, Saria Sweeney, Thomas Cheever, Angela Krause, Bryant Adsit, Stephen Ritchie. Who else? Allison McNaughton, Kyle Carney, Sarah Carney. Those are the ones that we read about in the papers, right? They went to dinner at their house. John Sullivan, Elaine Flatterty. Didn't Carney already testify? Now I'm getting confused if Carney testified or we read the stuff. I think Carney already testified, didn't he? I think so. Susan Bertolo, Stephanie Williams, Karen Kazolias, Jillian Barton, Ashley Sullivan, Susan Fraoni, Angela Hennigan, Michelle DeCanto, Amy Bevins, Lauren Masella, these sound like her, I don't know, Ryan Borowski, Christopher Bevins, Beverly Barbaro, Danielle Mastrangelo, Kristen Walton, Adam Schweibeck, Kira Sullivan, Bethany DeCalabas, Erin Renault, Elaine Rossi, Jennifer Shannon. Wow, that's a lot of witnesses. They probably aren't, I'm sure they're not going to call them all, or it would be like 5 months trial. I don't know why my arm is itchy here. Getting so paranoid now with all the spider bites, tick diseases. Like, is that a spider bite? Did I get a spider bite? Okay, what else? Let's see here. So Nurse Gelada and Nurse Paul from South Shore are not on the Commonwealth list. Oh boy. They say Ian Whiffen is apparently a digital forensic examiner who testified in the Karen Reed case. That'll be interesting to see what they found in her digital records and anything she may have deleted, like ways to kill. Okay. Allison Krauss is going to testify. Interesting. I want Lindsay to be a witness. Well, I don't know. They said that they were thinking that maybe that's why he introduced her journal entries, but didn't really. Oh, hi, Jen. Ian is wicked smart, is he? Allison Krauss, isn't she a singer? I don't think it's that one, right? Okay, so let's see what else is going on. See what else is going on in this world. Completely overwhelmed. Lindsay Clancy's diary read. Let's see what if we get some more before we do. See if they put this stuff out, so we don't have to go. I feel like I'm drowning every day, she wrote in one entry. Reddington noted entries in which Lindsay Clancy wrote that she had brain fog and that she felt completely disconnected with her baby. Lindsay Clancy. Spokane wildfires destroy hundreds of structures, forcing to flee. There's a nut butter recall at Walmart. So if you bought nut butter from Walmart, you better check it out. There's also a study revealing a cognitive decline linked to drinking Diet Coke on the daily. Trial delayed again. Oh, remember Sarah, oh my gosh, we just talked about her, Sarah Grace Patrick? Her trial has been delayed again. The young girl, remember she killed her mother and stepfather and then let her little sister find them? And then she was on TikTok and everything. You guys remember that? I talked about it not a few weeks back, but it says her trial is delayed again. Proceedings were set to begin Monday in Carroll County, but both sides have agreed to push it back. A new date is expected by the end of the week. They're probably not going to put a date until probably November. I'm just saying, I just think November or something maybe. That's what I think. Okay. think I might need Luke for a second. Hold on a sec. There's a picture of my arm because I want to see if I have a spider bite, because all of a sudden it's getting really itchy, and it's like, I don't know if I have 2 fang marks or something. Hey, Luke? Hey, Luke? Luke? Can you come here for a sec, please?
What's going on?
I don't know. Does this look like a spider bite to you or something? You see my arm?
Huh?
Here, I don't have my key. They can't see you. Here, look at my arm right here. Does that look like a spider bite?
No.
It's
Maybe.
itchy like crazy.
Maybe.
It looks like it might be.
I don't know. Not really.
You don't see like a couple of fang marks or something?
I see 2 little marks, but there's also. I could be, yeah.
I hope it's not like a recluse, because some lady's fighting for her life on that.
I don't think so.
I hope not.
Could just be a little bug bite.
Maybe, but it's really itchy. All of a sudden, it's like, hope it's not. Did you hear that rabbit tick?
What rabbit?
Don't go near any rabbits. They said they got a rabbit tick, and
We got rabbits all over here.
I know we have rabbits all over here. A kid in Long Island was 9 years old, and he got on his head, and he got a fever, a stiff neck. It's curable, but you got to be really careful. It's rabbit tick disease or something.
Ask Ethan. Ethan's right here.
Rabbit ticks.
No, ask him.
Oh, does this look like a spider bite, Ethan?
I don't know.
Ethan,
some more.
does this look like a spider bite to you?
Let me see what you got going on.
Nobody can see. I don't have my camera. Look at that. Does that look like a spider bite?
Is it itchy?
Yes, very.
I don't know. Could be. When did this happen?
I don't know. I just noticed it all of a
I
sudden.
just get big ass bumps on my back from shit.
From spiders?
Hey, Caitlin's come over tomorrow. She's gonna deliver my stuff. She's gonna sleep over. If
Okay.
I'm working, I'm kicking
Hold
her
on.
out in the morning.
Okay. So, yeah, guys, I don't know if it's a spider bite or not. I'll keep monitoring it. If it, the spider, one's got a spider bite. I got a huge bruise on it. All right. We'll see now. All right. Okay. Let's go. A trial delay. Yeah. So that Sarah Patrick is Sarah Grace Patrick. Iowa woman allegedly shot and killed man from behind during target practice. What? Oh my gosh. Indiana records 1,349 cases of the cyclospora outbreak involving lettuce. Don't eat any lettuce, Ethan. Anywhere you go for work, tell them no lettuce on your sandwich and everything. Do not eat any lettuce.
It's still bad?
Very.
Damn it.
Don't eat any lettuce.
Alright.
Tell them no lettuce. And they said it could be like it's like 2 weeks before you forget avocado toast. And a new kind of dinner.
Good night, love you.
Oh, good night, love you. Good night, Luke, love you. I've already said that to him before. All right, let's see. All right, Lindsay Clancy. Oh, look at this. This is Spokane. Look what lasted in that fire. Right? Right, you see there. Nearly 65,000 people were ordered to evacuate over the weekend. Are they getting any closer to getting this under control? This is 60,000 residents evacuated as the wildfires rage. Yeah, wow. A pendant. Hands a vase. I don't see a vase. Look at this picture. Look at this picture. Am I dreaming? It says this woman is allegedly handing him a vase. Where's the vase? Is this something right here? What is that? It looks like she's pinching her fingers. It looks like she's not. What? Where is the vase? I don't know. It says hands whose house burned. I don't know. And then somebody's handing him a pendant. I mean, he's taken these solar lights. I don't think those are going to work anymore, probably. He's probably just trying to take anything that's some kind of reminder of what stood before, right? What is that? Is that somebody standing there? See that? It's like what is that? I don't know what that is. They say reach out to someone you know who has been affected, offer a meal, a place to stay, help with errands, or simply let them know they're not alone. Small acts of kindness can make a bigger difference than you realize. That came from the Spokane County Fire District. Oh, we wanted to look up that other case, right? I think we might have talked about that, because if it was 2021, we probably talked about it at one point, but who remembers it now? Let's see. Where did I put that name? Murders, okay, of the Dickason children. Dickason, Dickason, a South African immigrant, Lauren Ann Dickason, September 16, 2021. She murdered her 3 daughters, 6-year-old Leanne, 2-year-old twins Maya and Carla, at their home in New Zealand. After admitting to killing her children, she went on trial denying that it was murder, but instead pled insanity or infanticide. She was found guilty of murdering her 3 children on the 16th of August, 2023, and she was sentenced on June 26, 2024, to 18 years in prison. Lauren is the daughter of Malcolm and Wendy Fox. She attended a boarding school in Pretoria, South Africa. From the age of 15, she experienced depression and anxiety. She also had postnatal depression. She later studied medicine at the University of Cape Town, completing her degree in 2004 and becoming a doctor. She subsequently completed her rural health practice in Pretoria, where she met her husband, Graham Dickinson, an orthopedic surgeon, in 2005, and they married in 2006. Lauren experienced multiple fertility struggles. To have children, she had 17 rounds of in vitro fertilization. She needed donor eggs. How old was she? Did we have an age on this woman? Not yet. Okay, she needed donor eggs. In 2013, she had her first child named Sarah, who had to be born after 18 weeks of pregnancy and died shortly after. Dickinson did not return to work following Sarah's death and became a part-time surgeon assistant to Graham. Dickinson had 3 other children, Leanne, who was 6 at the time of her death, and twins, Maya and Carla, who were 2 years old. Leanne was born September of 2014, while Carla and Maya were born in November 2018. Following the birth of the twins, the Dickinsons enlisted the services of a nanny named Maria Mendy Sabagnoni, who worked for the family from November 18th to May 2020. Let me get a photo of this person here, okay? I feel like we did discuss this at the time, but okay, one second. Okay, hang on. That's her husband, and the kids. Let's see. So let's go back to read more of this about facts. So she was diagnosed with major depression with underlying anxiety in 2015. That would have been before she had the twins. It would have been after Leanne was born. She reportedly experienced flashbacks of the loss of her child, sleep difficulties, crying, suicidal thoughts, panic attacks, restlessness, detached feelings, and intrusive thoughts. She experienced anxiety and depression leading up to and following the birth of her twin daughters, which was caused by Carla's cleft palate. Okay, wait a second. I feel like I saw a lady when I had Ethan in there. She was acting really... Okay, just had me thinking about something. Here's the thing that I don't get about this. Her baby was born in 2014. When did the first child die? Wait a second. The first child... in 2013, she had her first child named Sarah, who was born after 18 weeks of pregnancy. She died shortly after. Okay. Then she had Leanne right after that. Leanne was good, and the twins were born. Who was the IVF for all of them? Okay. In May of 2019, she saw a psychiatrist after experiencing homicidal thoughts. See, I thought we looked up who killed their... Remember we looked up something... Who killed their children after... And we got... Maybe we were looking up something else, because I know we had Andrea Yates and now Lindsay Clancy. We had looked up some... Maybe it was something different. I don't know, because I don't remember... getting her, or maybe that's when we were looking up the House of Horrors, who had 4 sets of twins. could have been that too. I don't know. All right, let's see. Or no, I think we tried to see who killed their children by postpartum psychosis. I thought they said it was only... Well, I'm going to look that up again. I know I'm all over the place. Okay. In May of 2019, she saw a psychiatrist after experiencing homicidal thoughts towards her children. The episode was triggered after she and her nanny struggled with putting her twins to bed. Wow. She had spoken about Carla being a difficult child, saying that Carla lashed out, slapped, and bit her. She said that her children were never enough. What does that mean? What does that mean, never enough? In 2019, the Dickinson family decided to emigrate to New Zealand. They planned to move in August of 2020. But is this the one? I think, did she stab them and then run down the road? I think we did cover this. Isn't this the one that... Yes. Then now I really remember this. I think she ran down the road, and I talked about, I remember how much she went through to have these kids and what her age was, and now I'm remembering this very clearly. If that's true, that if she runs down the road or something, and then something about her in-laws or something, and something about a van. Let's see. Without consulting her doctor, hold on, I'm ahead of myself. They planned to move in August of 2020, but their migration plans were delayed because of COVID and immigration issues. She experienced episodes of depression and suicidal thoughts during the pandemic. Her mood improved between late 2020 and June of 2021. The Crown claimed she experienced a remission for at least 2 months. She also participated in a wellness program. Without consulting her doctor, she stopped taking her antidepressants in March of 2021, but subsequently resumed her medication regime August of 2021. In July of 2021, her mental health deteriorated during the 2021 South African unrest triggered by the imprisonment of former President Jacob Zuma. Dickinson feared for the safety of her children and kept them at home. During that period, she experienced thoughts about harming and killing her children. She confided in her husband, Graham, who reacted with anger and convinced her to resume her antidepressant medication. She continued to experience homicidal thoughts following a foot surgery, but did not disclose them since she feared it would affect their immigration plans. That same month, Graham's Essential Skills Work Visa was approved by Immigration New Zealand. In July of 2021, one of Dickinson's friends sent her a TikTok video where a mother recites a poem named Mom Needs a Minute, and the struggles of raising her children and the chaos inside of her brain. And Dickinson responded by saying, "Awesome! XXX. That's exactly how I feel." Over the following months, Dickinson searched the internet for different methods on how to overdose her children. In August of 2021, she experienced thoughts about using cable ties to asphyxiate her children after witnessing her husband and the girls playing with cable ties in the family garage. The incident occurred 2 weeks before the family emigrated to New Zealand. Dickinson became withdrawn and communicated less, cried frequently. And during testimony, her mother, Wendy, recalled that her daughter's mental health had deteriorated during that period and she had experienced significant weight loss. Following 2 weeks in managed isolation, the Dickinson family arrived in Timaru on September 11, 2021, 5 days before the children died. Dickinson was unhappy during her time in Timaru, taking issue with the appearance of the town's residents and describing local rental accommodations as small, disgusting, and creepy. She feared that her children would be the target of cyberbullying when they became older, and likened the treatment of indigenous Maori people to apartheid in South Africa. These issues led her to regret emigrating to New Zealand. According to defense experts, Dickinson became fixated on these issues to the point that they became delusions reinforced by her depression. The children were murdered on the night of September 16, 2021. Okay. On the day of the murders, Carla and Maya had attended their first day of preschool, while Leanne had attended her second day at Timaru Christian School. After picking up her daughters on that day, Carla threw a tantrum in the car. Later, the family visited the local botanical gardens. During that trip, Dickinson alleged that a group of girls had warned her that a boy in the park was photographing her children, which led her to believe that New Zealand was as dangerous as South Africa. The same day, Dickinson had thoughts of brutally killing the children by means of sedating them and cutting their femoral arteries. That night, Graham went out with his colleagues and left Lauren alone with the children. During a subsequent police interview, Lauren told those detectives that the children on that night were being wild again. They were jumping on the couches, not listening to what I'm trying to tell them. She also told police that something just triggered her on that night of the children's killing. Okay, this is nothing like Lindsay Clancy. Just hate to say this. I mean, there are some very little similarities, but this is seeming to come from a totally different place, and she's not taking her own life, or I don't think this is, as much as it is similar because she killed her children and maybe she wrote some things. But again, most mothers can write things like that in a journal about their kids not listening, jumping on couches. Okay. She told police something just triggered her on that night. That she had been triggered by the Immigration New Zealand request for more medical information about Kayla's cleft palate and her own mental health, as well as feeling that she did not have the strength to make the children's school lunches. After gathering the children in a bedroom, she told them they were going to make necklaces with cable ties, tricked them into wearing the ties around their necks. She said she told the children, "Mummy's very sick and is going to die. I can't leave you behind because I don't know who's going to look after you." Say, well, now, okay, maybe it is more like her. But did she try? I don't think so. Dickinson then asphyxiated her children, starting with Kayla, and then Leanne, and then Maya. Dickinson told police that Kayla had been really horrible to her recently, and that Leanne had fought back. She recalled that the oldest one was very angry and wants to know why I'm doing this to them, because I'm the best mom and she loves me. Since the children were still breathing, she smothered them with a towel and their blankets. Afterwards, maybe this is more like it. She tried to take her life with knife and with pills. The bodies were discovered in their beds by Graham after coming back home. Graham also confronted a distraught Dickinson, who told him it was too late, before falling into a catatonic state. Okay, maybe this is more like that. At 10 p.m. on September 16th, police in Timaru responded to a call by neighbors, Karen and Brad Cowper, who responded to a distraught Graham at the house. Police found 3 dead children and Lauren Dickinson, who was hospitalized in stable condition. Police were also joined by Graham's work colleague and his wife Kathy, who had responded to Graham's phone call. They had also called police. Dickinson was taken to Timaru Hospital on September 17th. Police interviewed Dickinson, who admitted to killing her 3 children. Later that day, Detective Inspector Scott Anderson confirmed that police had arrested a 40-year-old woman about the deaths of her 3 children. Anderson said that the children's deaths were an isolated incident and the police were not seeking anyone else. On the 18th of September, she was born in 84. Okay. Timaru District Court was later remanded to a forensic psychiatric ward at Christchurch Hill Morton Hospital. She was later placed in a hospital psychiatric unit. At Hill Morton Hospital, she was interviewed by 5 forensic psychiatrists and psychologists for 53 hours. Three of them, Susan Hatters Friedman, Justin Barry Walsh, and Gazi Matau, believed she was severely mentally unwell and could claim a defense based on insanity and infanticide. The two others, Eric Monasterio and Simone McLevy, believed that Dickinson killed her children out of anger and control, including not wanting to let another woman parent her children if she either died or Graham remarried. On the 5th of October 2021, Dickinson's lawyer, Karen Beaton, sought an extended remand for her client at Hill Morton Hospital. Dickinson had been scheduled to appear at Timaru High Court that day, but her appearance had been delayed due to an impending mental health assessment. Okay, on October 15th, Beaton told a court hearing in Christchurch that Dickinson would plead not guilty to the charges of murder. Dickinson was unable to attend the court hearing since she was ill. Beaton sought further remand for Dickinson to Hill Morton Hospital until her next appearance, which was not opposed by the Crown prosecutor Andrew McRae. Trial date for March 2023 was set in Timaru. Okay, in the opening arguments, here's what happened. Andrew McRae served as Crown prosecutor. McRae delivered his opening address and detailed the circumstances of the children's deaths and her attempted suicide. Now, her defense lawyer, Ann Toohey, also outlined the defense's opening arguments, while the Crown has argued that Dickinson's murdered her children because she resented the impact they had on her marriage. Dickinson is not pled guilty to murder due to insanity or infanticide. Okay, then trial evidence. In addition to testimony from Graham, so I guess he turned against her, right? Okay. Emergency responders and the children's teachers, the Crown also utilized digital forensic evidence and Dickinson's police interview following the children's deaths. Now, you know what? Can I tell you something here? Didn't they say she had... I'm finding something else. Didn't it say she had to have donor eggs? That's another whole component in this. Because, right? What if she's saying, oh, she had donor eggs, and that's why her daughter had cleft palate. If it had been her eggs, she wouldn't have had... You know, I wonder if how much of that, all of that, and what else, you know, what else... how that affected her, and maybe that they're his biological children. Do you know what I mean? And maybe that was also another component, that if she took herself out or left, he could get married with someone else, and that person would literally, she could say, I would have as much connection to those kids as she did. You know what some things that could be going through her mind is what I'm saying. If they're saying that she's focusing on this cleft palate, is it possible she's focusing on this cleft palate because of the donor egg? Okay, let's see. On the 26th of July, the Crown rested its case, and defense counsel Toohey delivered her opening address to the jury, arguing that the defendant's decision to kill her children was spontaneous because Dickinson believed that her and the children's lives were not worth living and that they were all better off dead. In addition to the defendant's mother, Wendy Fox, the defense also relied on 3 expert witnesses: the forensic and reproductive psychiatrist Dr. Susan Hatters Friedman, forensic psychiatrist Dr. Justin Barry Walsh, and forensic psychologist Gazi Matau. I don't even know how to pronounce his last name. The prosecution also called 2 expert witnesses, the Canterbury District Health Board clinical director and psychiatrist Dr. Eric Monasterio, and Hill Morton Hospital consultant psychiatrist Dr. Simone McLevy. Closing arguments. On the 11th of August, McRae gave the closing argument for the trial. The Crown said that Dickinson knew what she was doing was morally wrong, and that there was no altruistic motive, and that the key drivers of the murders were anger and control. McRae said that this was a trial by jury, not a trial by experts, stating that the defense experts who assessed Dickinson did not do it during the time of the murders, whereas the Crown did. The Crown also said the defense experts ignored crucial information. Dickinson provided inconsistent accounts of what happened for explanations months apart. The Crown said that the postpartum depression had remitted and that it was at best a minimal contributor. The children were 2 years old, right? Yeah. The Crown said that the evidence provided by the defense experts should be treated with great caution, as Dickinson reported killing Carla first on multiple occasions because she had been misbehaving, such as biting and scratching her. The defense, however, has said that Carla was killed first because she was the closest to Dickinson. When asked whether she thinks the murders were a result of her postpartum depression, she answered no, and that the idea for killing just popped up. Although the Crown later said we knew the thoughts didn't just pop into her head. The closing address of the defense stated that at around 2:30 p.m., the address mentioned Dickinson's 16 rounds of IVF, that the family moved to New Zealand in order to provide a better life for the children, and that the world was dangerous for her children, that Dickinson had postpartum depression after the birth of her twins, that her mental health made her very unwell, and that Dickinson's husband did not understand her illness, that Dickinson was reliable and consistent when talking to experts. They said that she was not asked by police why she killed her children, and that Dickinson didn't tell anyone that she killed them out of anger. The defense also said that Dickinson's brother, sister, or close family members could have given context about her life. On the 5th week, Justice Mander summed the case up. He talked about the police interview on the day after the deaths of her children, and then told the jury to not let emotion change their ideas. In particular, sympathy, prejudice, and others caused by media attention. He mentioned that there were no disputes about Dickinson causing the deaths of the children, and that the question is whether it was murder, infanticide, or insanity due to undisputed unbalance of Dickinson's mind at the time. He also summarized the evidence given by the experts assessing Dickinson's health. On the 16th of August, 2023, Dickinson was found guilty of murdering her children in the Christchurch High Court. Following 15 hours of deliberation, the jury reached a majority verdict, 11-1, to convict Dickinson on 3 counts of murder. The majority of jurors rejected her partial defense of infanticide and defense of insanity, and accepted the Crown's argument that Dickinson acted methodically, purposefully, and even clinically out of anger and control when she killed her 3 children. Dickinson stood motionless in the dock as the verdict was delivered. She wept as she was led out of the court. Both of Dickinson's lawyers and several members of the jury wept following the verdict. Justice Mander remanded her to Hill Morton Hospital until her sentencing date, stating she was under a compulsory treatment order that made prison inappropriate. Mander has also sought experts' reports on Dickinson's mental state and an appropriate sentence. Following the verdict, Dickinson's parents, Malcolm and Wendy Fox, issued a statement blaming postpartum depression for taking the lives of their grandchildren, Leanne, Carla, and Maya. They also stated that there were no winners in this tragedy, and urged greater awareness of the effects of postpartum depression. The judge asked to determine the length and type of sentence following a mental health assessment of Dickinson. The Sentencing Act presumes that murder would result in life imprisonment unless it would be manifestly unjust to do so. The decision on whether Dickinson will go to jail or the psychiatric unit of Hill Morton Hospital has not been decided. Dickinson will not be extradited to her home country of South Africa. In early September 2023, Dickinson's sentencing date was set for the 19th of December 2023. It was later postponed to 2024. On February 14th, the date was set to March 20th. It was later rescheduled to the 26th of June due to delays caused by determining whether she would serve her sentence in prison or be detained as a special patient under the Mental Health Compulsory Assessment and Treatment Act of 1992. Until the 26th of June, she will be staying in the Hill Morton Hospital. She was sentenced on the 26th of June 2024 to 18 years in prison at 3 concurrent determinate sentences of 18 years. She was not given a minimum term of imprisonment, and she will be kept in a mental health hospital until she's deemed mentally fit for prison. When the sentence was delivered, Dickinson was silent and had no reaction. During the sentencing, victim impact statements from Dickinson's family members, including Graham, and both paternal and maternal relatives were read. Dickinson has been served with a deportation order that will take effect upon her release from prison. Okay, let's see. So, but then in early August of 2024, her legal team had launched an appeal against her conviction. The grounds of the appeal were not disclosed. Oh, there's a Facebook group, Support for Lauren Dickinson, which attracted thousands of members, including her father, Malcolm. The group was started in July of 2022 with over 1,900 members from multiple countries. Okay, so yeah, it's like maybe it is closer to Lindsay. I don't know. Let's see. I'm going to see what else there is on her. New Zealand, triple murder, Lauren Dickinson's appeal. Let's see this. Do they have her? Let's see. Here, she looks different now. Here's her picture, I guess, of her. I guess her husband didn't stand by her, right? She has an appeal against her conviction for killing her daughters will be heard in February when she intends to argue there has been a miscarriage of justice. She was sentenced to 18 years in prison in June of 2024 for smothering 6-year-old Leanne and 2-year-old twins Carla and Maya in their beds in their Timaru home September 2021, weeks after the family migrated to New Zealand from South Africa. Dickinson launched an appeal in July of 2024 with a Court of Appeal hearing now set down for 3 days in Wellington from the 9th of February. According to the notice of appeal, Dickinson states that she wishes to appeal against her conviction on the grounds that there has been a miscarriage of justice. Remember, we used to have a Leah from New Zealand. The first time she came on, she burned a cake. My lawyer will particularize my grounds for appeal in due course, the notice said. Dickinson will be eligible for parole once she has served a third of her sentence in September of 2027. She has pled not guilty. It's almost a year from now. It's not too far. She has pled not guilty to 3 murder charges, with her legal team mounting a defense based on insanity and infanticide. Justice Mander imposed no minimum non-parole period, saying her severe mental illness was not only a contributing factor to her actions, but the cause. She was initially sentenced to an inpatient care and treatment unit as a special patient because of her mental health condition. Following her sentencing, Dickinson issued a statement saying she loved her daughters with all of her heart, but had failed them, her husband, and their families. She said she took responsibility for taking 3 beautiful girls from this world and wanted to express the deepest and most sincere remorse for the extreme pain and hurt caused to her children and family by her actions. Okay, I'm going to go back to the chat. What do you think about this? What do you think about this case? Hi, Rosalita. What do you think about this case? Hi, OU8. How are you? I didn't think Carolyn, I said Dickinson. Her name is Dickinson, is the last, that's what they call her. First name, what did I say her first name was? Hold on. Lauren. Lindsay Lauren. Yeah. Dickinson. Hold on, I gotta put my watch on the charger. I'll be right there. From South Africa, she had a very privileged life, it seems, right? She was a doctor, and then so there are some similarities. They were both in the medical field. They both had 3 children. They both killed their children. They both failed at taking their own life. Oh, wait. Hold on. Her husband, I thought he would testify against her. Let me see. Hold on, listen to this. Lauren Dickinson wasn't a physically affectionate mom. Hold on, let me get this here. Put this picture up. She wasn't one to pick up her daughters and shower them with kisses, but that didn't mean that she was capable of murdering them in cold blood. This is what Lauren's husband, Dr. Graham Dickinson, told police shortly after Lauren had killed their 3 young daughters. Leanne, 6, and twins Maya and Carla, 2, on September 16, 2021, while he was having dinner with colleagues. The mother of 3 is alleged to have tied cables around the children's necks to choke them after telling them they were going to make necklaces. When that didn't work, she smothered them with blankets. The court heard a recording of a police interview with Graham shortly after he returned home to find his wife disoriented. She's believed to have attempted suicide after killing her children. Lauren, Graham said, is a tortured soul. The couple, originally from Pretoria, moved to New Zealand in 2021, just a few weeks before their children were killed. Lauren had gently tucked her daughters into their beds, surrounding them with plush toys after she killed them. Okay. New Zealand authorities withheld these revelations from the public for nearly 2 years because the court issued a suppression order preventing information about the case from being made public. This is done to prevent potential jury members from forming a biased opinion about the case before the trial. Suppression orders have been put on cases to prevent copycat incidents, and our rules on reporting suicides make it very difficult to describe any details which may aid another person in following in the example. Okay. But when Lauren's trial started, Andrew McRae described the grisly details of the children's deaths in his opening statement. The 3 girls were murdered in the family home in Timaru. The prosecution opening will always include the details of the crime. They are necessary for the jury to be able to find that the defendant killed the victim. They will usually include the means of killing them, even when it's distressing as this. If Lauren had denied that she killed the girls, the state would have included even more details in its opening statement. But that part isn't in question. The actual facts are agreed on in the case. The whole case hinges on her mental state. Lauren is pleading insanity because, according to her lawyer, Karen Beaton, she wasn't in her right mind when she killed the children. Beaton told the court that Lauren loved her daughters very much. This is brutal. It's confronting. It's difficult to hear and to imagine. You'll be rightly shocked and horrified today, Beaton said in her opening statement. That's understandable because what Lauren Dickinson did is horrifying. But the truth is that Laura Dickinson is a woman who longed to be a mother, who went through 17 rounds of IVF to have her 3 daughters. Oh, so maybe the 1 round was for the 1 daughter and 16 rounds for the twins? She wanted those children very much. And she loved her family. She had severe mental health issues. But McRae argued Lauren had planned the murders. Hold on. Trying to get another graphic up here. She seems to be holding her kids in every photo. I wonder what. Is it just for the photos that she did that? Why did the husband say that? Let me see here. The New Zealand legal system is very similar to South Africa. New Zealand's litigation is accusatory and the Crown must prove beyond reasonable doubt that the accused is guilty. The biggest difference between our 2 countries is that New Zealand has 12 jury members who must make decisions based on the facts presented in court, and in South Africa we have a judge and no jury system. In New Zealand, the judge will address the jury before they decide on their verdict, providing advice on how to consider and analyze the evidence heard in court. Okay. Let's find out where her husband is now, right? Let's find out where he is. Okay. It says, it seemed impossible that he'd ever feel happiness again after the pain he'd suffered in 2021. Dr. Graham Dickinson, whole world fell apart when he returned home from a work function to discover his wife, Lauren, had murdered their 3 young daughters. Do you remember that case? It was a while ago. Somewhere in Connecticut, maybe, I believe. And the woman, had her 3 children late in life, and there might have been a set of twins in there, might have been IVF and all of that. And she was getting divorced from her husband, and she was at her parents' house for like Christmas, and there was a house fire. Do you remember this? I'm going to look that up, and I think she set that house fire. and the 3 girls were killed. I feel like I've told you guys this on this channel too, even though it happened way before I was doing true crime. And then I remember the poor husband, he had to go, I think it might have even been in Long Island or something, or in the city. So I remember I had such a visual. The husband had to go, he was outside at the house and they had to, oh, it was horrible. Okay, we'll look that up in a minute. The tragedy occurred just weeks after the family had emigrated to New Zealand. Okay, hold on a minute. So now they say that he got engaged and is married. When was this? Let's see. I don't see that. Okay. Quietly remarried, I think it said. He kind of looks like the guy from 90 Day Fiance that's married to. Oh, he found love again. Let's see. The ex-husband of the convicted triple murderer, Lauren Dickinson, has remarried in South Africa. It has taken years for Graham to even begin putting his life back together after the tragedy of September 16, 2021. Now his family is simply relieved that he has found love again after such a devastating loss. It's not a fairy tale ending, and it was never going to be. But after everything, it's a reminder that even the most broken lives can still find space for hope. I wonder when he divorced her, like when. I don't think he's divorced yet. He's not remarried yet. He did not divorce as their marriage was instead impacted when she was convicted of murdering their 3 children. Okay, but he would still have to end their marriage. Right? Oh, wait a second. Now they say, hold on. There's something else. Kathy Savatnich arrived at the Dickinsons' Timaru home after her husband Mark was called by the distressed father. That's what we just saw before. Telling him his wife had killed the 3 girls. Lauren has pled not guilty. Graham and Mark had just returned to their respective homes after a work event with other colleagues from the Timaru Hospital. In a statement she read to the court, she said that Graham Dickinson was howling outside the house when they got there. He had his jacket over his head. He was sitting on the ground. She said Graham told her she's mad. He couldn't believe she'd killed them and that he'd been married to her for 15 years. She stayed with Graham while her husband talked to police and told them what he knew. I just held him, she told the court. I think I asked him, why would she do that? He said, She suffers from depression and anxiety. And then she said Graham got up, walked to the back of the property crying and saying, "My babies." Kathy, I can't even pronounce her last name, said she saw Lauren leaving the house, walking with someone on either side of her, but noticed she was really wonky. She described the girl's father as being distraught and not aware of what was happening. She didn't think Graham saw his wife leaving. He said to her, "She's done this to hurt me, and it's my fault." Okay, let me go back and see what you guys are saying. Okay. I vaguely remember. So yes, it's gone to court. Wait, which one? Who are we talking about? No, this one's in court. She's already been convicted, but it's in New Zealand. She got 18 years. She's eligible for parole in September of 2027. And she's appealing on something but hasn't disclosed that or so. Yeah. Okay, let me get something else here. I want to read. I have to go back to that fire in. I found it. It was Hartford, Connecticut. Christmas Day, 2011. I could swear it was earlier than that, but let me see if it was the wife. Hold on a minute. The latest on a 2011 Christmas Day fire that killed 3 children and their maternal grandparents at a home in Connecticut. I don't know if she set the fire. I don't know if I remember this correctly, but let me. This is the one. The father of 3 girls killed in a 2011 Christmas Day house fire in Connecticut said he will not rest until he gets answers about why his precious daughters died. Matthew Badger's attorney said they'll continue pressing their case until they get the whole truth. Badger wants to know what caused the Stanford house fire that killed his daughters and their maternal grandparents, his wife's parents. A contractor who was dating Badger's wife initially took the blame for accidentally starting the fire. But now the contractor says it was Badger's wife who left a bag of fireplace ashes in a mudroom. The children's mother, hold on a second here, Madonna Badger, had said that the contractor ran his hands over the ashes to make sure they were out before putting them in the mudroom. She says she believes the fire may have been electrical in origin. The contractor who took the blame for accidentally starting the 2011 Christmas Day house fire that killed his girlfriend's 3 children and her parents now says it was the children's mother who left the bag of fireplace ashes in the mudroom. Bochina had told authorities he put the ashes in the mudroom. He later agreed to pay $5 million to settle a lawsuit. Bochini and Badger escaped the fire in Stanford. The deposition is part of one of several lawsuits filed by the children's father, Matthew Badger. Neither he nor Madonna Badger immediately made a comment. Okay, so that's a little different than I remember, so. Let me see here. Oh, yeah, she was an ad executive. Okay. This was it. Let's see. Huge flames could be seen shooting from the roof of the Victorian mansion. 2 people made it out alive. Ad executive Madonna Badger. Police identified the victims as Badger's 3 children, a 10-year-old and 7-year-old twins. See? Twins, yep. And both of her parents. Neighbors say the house was under renovation and the family had just moved in a couple of months ago. Badger, an ad executive in the fashion industry, is the founder of the New York City-based Badger and Winters Group. A supervisor at Stanford Hospital said she was treated and discharged by Sunday evening. Authorities say a male acquaintance of Badger, who also escaped the blaze, was a contractor who was doing work on the home. He was also hospitalized, but his condition was not released. Police officers drove Badger's husband, Matthew, from New York City to Stanford on Sunday morning. The cause of the fire has not been determined. Boyfriend's story changes over Christmas fire. Okay, the fatal Stanford Christmas Day fire. Yeah, that was something. Okay, let me see what's going on here. What's going on? Rosa, for sure it would have been what? Must have been happening in a different country. The United States. Oh, yes, it was New Zealand. Yes, it was New Zealand. Hi, Hart. Yeah, Australia gets even less. Don't you remember? We had some of our Australian ramblers tell us how little they get for murder. Okay, let's see. So, yeah, we got all that. Sorry for everybody that came in here when I was... If I didn't see you or say hi, I'm sorry. Okay, so, we got to do 2 daily puzzles. Heart, we forgot our daily puzzles last night. We got to do 2 dailies. Trial starts in the morning. It's 2 o'clock. Thought we'd hear that sound another time. What do you got, Jeannie? Yeah, I got that. Wine, win, pew, weep. Oh, weeping? Right, weeping. And weep. Right, and then there's wipe. Okay, that was an easy daily, right? We just need to do the other daily we missed last night. Okay. ring, rip, pin, pig, gin, I do ring, ping, zing, okay. One of my kids is in the shower at 2 in the morning. What the freak? Grin. Okay, good. Dawn, we now pond, Mont, no, Toppins, timid, pond, point, right, mind, mid, pin, idiot. Don't call me that, Heart. That's not nice. Heart, that's not nice. That's really not nice. Come on. That's not nice. Everybody, Heart called me an idiot. Just because I didn't see her word or something. Heart, come on. Pinto. Hi, Justy. How are you? How are you, Justy? How's it going? How you doing? Can you guys hear me? Can anyone hear me? If you can hear me, can you put up a 29? Please? Hart didn't even deny calling me an idiot. Not nice, Hart. You can hear me? Okay. 29, thank you, Rosalita. And Jen. 29, hey now, Ari. Hey now, you're a rock star. Okay. Oh, okay, you finally said it, Hart. I thought you'd be like, oh, I wasn't calling you that, Carolyn. I would never. She's like, ha 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 ha. Oh, brother. Oh my goodness. Where's Scooter on this fine evening? Omit. Good. Pinto. I tried Pinto. It's not there. I tried it. I did. Pinto. I tried it once. Say Pinto. I got midpoint, Hart. Aren't you proud? Aren't you proud? Oh, this is going to be an advancement, Hart. Look, we're almost done, and we don't even have murder here. Oh. Oh, you did get midpoint 10 minutes ago? I didn't even see it, really. I didn't see it. Surprised. I was surprised that I had that. Okay. It can't be Dom because there's already dot. Right? Can't be that. Where's imp? All right, now we have two more. Yeah, mod's a good idea, but it's not there yet. Dino? Hold on. Nope. Ding. There's no G. Didn't. Didn't? You say that? Didn't. Didn't. I think Rosalita said that. No, she said don't. Didn't. Didn't. Yeah, I tried that, although it's not there. Huh. No, we only have a 5-letter word left. What is it? Python? I have to get that auto translate off. It translates things it shouldn't. You give up, just? Don't ever give up. You can give in, you can give out, but don't ever give up. Don't ever give up. There you go. See? Pittin'. What did we become? Oh, we're still a cabbage? Oh, we have one more, and then we have to do the next. Okay. This is easy. Word. Wormwood? Wormwood, very good. Like we had that before. And a woodworm, yeah. There, now we made the advance. We gotta play the next game. Very good. Good, everybody. Good job. Good job. Teamwork makes the dream work. Oh, astounding. Chef rank up. What are we getting? Astounding chef. Look at that. We got a chef. some people look all of them and they see, oh, there's a special level. I never look at any of that stuff. It's so crazy. I don't even know what that is about. These achievements, okay. Then usually there is like some kind of weird thing, okay. See, these are easy levels. These are crazy. Sometimes they do this. I don't understand this. No, we can't. Wait a minute. No, we can't because you need 3 E's and we don't have them. Oh, even, yep. There we did it. We did the first game that we always have to do, so we're up to date on that. How come they have these easy ones? I don't. Sometimes they do that, right? Oh, decree. Yeah. I remember that when you have a received your decree. Very good. Ginger. Pink. Pink has been, no, there's no pink. But there's a 9. Higher. Good. Hold on a minute, I gotta put my earbuds on the thing. Hold on a second, okay? Hang on. Oh, my goodness. Oh, I'm tired. Where did I? Oh, here they are. I'm getting tired. I just dropped my stupid paint. The second time I've done that. Okay, where's my thing here? Hold on a minute, I've gotta just help these. Where's the thing on them? How come their little thing is not? Oh no. Hold on a minute. Let me get the fan. This fan has come so handy. So I have to, let's see. Okay. Okay, it goes there. Hang on a minute, heart, I'm coming. I just have to take care of this. I have to take care of this. All right, let's hope this works. Okay, good. It looks like it is. Whew. That was scary. All right, I had a little issue. Hold on, I don't know if I want to. I'm just getting myself a kiwi. Okay. Now I have to play because I have to wait a few minutes for my earbuds to charge. All right. Okay, what do you guys got? I'm here, you guys. Aaron? Reneg? Jenner? What do you have? The fan came with my swag. The fan? Yeah, we got this. It's the swag we got from Ninja Shark. It's come in so handy for so many things. Used it every day. Inner. And we're sending you home with chill pills. So I'm like, I don't even know what the heck it was. I saw them on display. But I was looking at other stuff. Okay. I think I tried that. Chill pill, I know, right? I didn't. Yeah, there's not another E. There we go. Thank you. There we go. I gotta play another game because I have to have my things charge, my earbuds. Making is good. Chaining. Good. Gang. No, there's not another G. Hag, I tried. China. I tried that, it's not there, watch. Oh, wait a minute. I did something wrong. Okay, never mind. It's there. All right. Ching. How about Ching? Oh. Icing, yeah. Shoot. Very good. And I think I have to go to bed. Oh, I know what it is, I think. Yeah, oh, finally. And a new game opens up, and I'm like, okay. Honest, your nine was not showing up. It must be that stupid translation thing. Oh, it does, right? It does. Yep, got it. That's great. We did a lot tonight. Advancement and onto, hey, Luke. Oh, desk. There we go. Let me check on my charger. See if we have any. See if we're there yet. No, I still have to keep charging it. Oh my gosh. This is crazy. Okay. Sufficed. Okay. And suffice. Very good. Use side. Let's see. Scuff. Cuffed. Cute. Okay. Okay, I thought I could stay up, and now I'm going to bed. All right, I appreciate everybody hanging with me. Thank you so much to the moderators. Thank you for everybody hanging out in here and talking about this case and liking the video. And thank you to those that watch on the replay. Please hit the thumbs up, share it out if you can. Consider becoming a member. Consider becoming a Patreon. Considering leaving super thanks or anything that helps the channel. That's much appreciated. I like you. I can't even talk. Prayers for all of you and all of us, because we all need them. Be kind. I love you all. God bless. Have a good night, and see you tomorrow, God willing. Okay? Good night, everybody. Thank you. Thank you, heart. See you later. See you later.